have been studying at Hebei Medical University for 8 years already. The changes here have been truly remarkable. Now things are much more convenient.
Witness 5 years of great change. Welcome to Hebei in their eyes. Hi guys, this is Mengxin. We always say that the house is the foundation and everything else is built on it. Against the grand blueprint of the Healthy China initiative, every region is exploring its own path. Today, we've invited Selina, a student from the International Education School of Hebei Medical University, to share her perspective on healthcare transformation taking place in Hebei. So, hi Selina, I'm so happy to have you here. So, how many years have you been studying in Hebei?
I have been studying at Hebei Medical University for 8 years already.
So, during the years, and what changes in healthcare services have left a deep impressions on you?
The changes here have been truly remarkable. What stands out most to me is how much stronger the healthcare system has become. For example, before, information wasn't always interconnected, so large hospitals were overcrowded, while primary healthcare institutions were underutilized. But now things are slowly changing. I have participated in online consultations with my professors, witnessing how expert doctors from provincial hospitals can guide local doctors at county hospitals to help them handle some complex cases. So now this way, patients in both rural towns and urban areas can get access to high-level resources. And hospitals now are also more like a closely connected network.
That's right. Your description is very vivid, and behind this network, a less solid policy support. We have a key statistics to share, and Hebei has established 193 integrated county-level medical communities and covering many parts of the province. And what are your thoughts on this?
It means that the pathways to saving lives have been greatly expanded. I remember during this year's summer social practice, I joined a rural medical outreach program where I saw how local doctors could reach out for help to higher levels hospitals to get confirmation in diagnosis or get a second opinion when it comes to complex cases.
Indeed, behind this lie the roots that these medical communities have established at the primary level. You know, in recent years, the digitalization has continuously transformed people's lives, and Hebei has also been vigorously promoting the development of smart healthcare. So in this aspect, do you have something to share with us?
Yes, digitalization has really improved the medical experience. I still remember when I just came to China in 2017, things were quite different. It was quite challenging to see a doctor, especially as a foreigner, because some places couldn't even register a medical record for you. To go make an appointment, you had to go to a hospital. To get your medical results, you had to go to a hospital. Now things are much more convenient. All you need is your phone to make payments, to make appointments, to get your medical results. All the records are all on your phone. It's really convenient. But what amazed me the most were probably 5G ambulances, which enable hospital admission upon boarding. So basically, vital signs of patients can be transmitted to the hospital in real time during transit, allowing emergency doctors to prepare in advance. In critical moments, such equipment can truly make a difference and save lives.
So Selina, as a student of the modern medicine, have you ever learned something new from the traditional Chinese medicine? You know, seeing how Hebei uses digital and quantitative methods to study traditional Chinese medicine.
That's actually something that really interests me, because before coming to China, I used to think that traditional Chinese medicine relies more on experience and tradition. But here in Hebei, I have learned that they're pushing forward quantitative research in TCM, analyzing and verifying its effectiveness using scientific methods. I also realized that the TCM approach of preventive treatment aligns with today's emphasis on preventing illness by early intervention.
you're right. You know, this shift from treating illnesses to preventing them is also reflected in Hebei's public health system development. So in your daily life, have you noticed how this prevention over treatment philosophy is implemented in the practice?
Yes, definitely. I have noticed that the public health network here is extremely well structured. I was particularly impressed by the efforts in chronic disease management and early screening. For example, initiatives like free screenings for breast and cervical cancer and early detection of lung cancer. These initiatives have significantly advanced the health protection front. So these are aspects that I have paid special attention to during my internships and studies.
So Selina, since we've been talking this much, I believe you had many reflections during your studies. Is there anything you'd like to share about the current state of the healthcare or your hopes for the future?
Yes, absolutely. Studying here has given me a much deeper understanding of how a healthcare system evolves and how much effort goes into making care more accessible for everyone. What amazes me is the clear focus on people's well-being, from strengthening primary healthcare to advancing medical services and improving public health systems. For the future, I really hope to see even more international exchange and cooperation because healthcare challenges are global and learning from each other is essential. I also hope to see the progress that we made today. I hope that it continues to be more accessible to more communities, especially those in remote areas. Ultimately, I believe that with continued innovation and dedication, the healthcare system will keep moving toward greater equity and efficiency.
Thanks for sharing with us, Selina. Thank you.
Yeah, you know, I went to the hospital several times.
I accompanied my friend. He wanted to visit the doctor, and we went there several times.
The hospital is modern and the doctors, they're really professional. It's really convenient. It's full of technologies and it's really fast.
I can say it's impressive. The service, how everything is managed, everything is fast, and everything is convenient. For example, in order, if you want to give your analysis, check some micro ingredients in your blood, like a calcium or D3. It's also very convenient. The way they do it is very professional.
Yes, I have done some traditional Chinese medicine. I've done the cupping, you know, where they put the big cup on your back. I did that once. Maybe it looks a little scary, but it does help make your back feel better, so that's good. I've also tried some traditional Chinese medicine like herbs, and they are very bitter, but they do also help. So I've found that traditional Chinese medicine, while I was initially skeptical, it is working, so I'm more open to it now.
Over the past 5 years, from the synergistic efficiency of grassroots healthcare to the convenience of smart healthcare, from the innovative development of TCM to the strengthening of the public health network, each step of progress reflects the development philosophy of putting people's health at the center. Standing at this new historical starting point, Hebei will continue to adhere to the general principle of pursuing progress while ensuring stability, deepen the synergy among healthcare, medical insurance, and medicine, implement the capacity building projects, and promote a profound shift from treating diseases to safeguarding people's health. In doing so, healthy Hebei will become the warmest cornerstone of people's livelihoods across this ancient land.